Hello, it's Dr. Scott Harrington coming to you live from my virtual doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor virtually from most U.S. states. Also, if you live in Florida, I'm now open in Pinellas Park on Fridays. Come see me in person or online, not just as a one-time consultation, but as your primary care doctor, someone who gets to know you, someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you're a vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, diet, exercise, and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health, and through the power of a healthy lifestyle, we'll work to heal your chronic conditions and help you get off chronic medications. Remember that this content is for educational and entertainment purposes only. This video is not intended to take the place of your own doctor's advice. Okay, we're streaming on multiple platforms, ready to take your questions. It's a little bit rainy today, so on my roof you can kind of hear a little bit pitter patter. What I'm going to do is I'm going to go ahead and go to a separate screen, and we'll kind of go over a few things here briefly. Let's see, I'm going to share my screen. Let's see, share screen. Boom, share. Okay, and I'm going to play this. Okay, so once again, I wanted to highlight the fact that my practice here at Vegan Primary Care is nearly nationwide. We have lots of states available. If you're a vegan in Colorado or a vegan in Idaho and you need a doctor you want to have as your primary care doctor, I'm available. Just contact me on my website, veganprimarycare.com, and make an appointment. One of the things that my patients love about our practice is this accountability app, a food logging app called the 8 app. So what I do is I log all my food to the 8 app and I share it with my patients, and everybody has a great time doing it. And it helps you stay accountable because it puts that little bit of pause before you scarf something down. You just take a picture of it and you think to yourself, man, should I really do this? So this is very helpful. And on top of that accountability app, I also have a Get to Your Goal weight loss weekly visit where patients will come into the virtual Zoom meeting that they have our normal visits at if they're virtual. And we all meet together and we discuss what went right and what went wrong, our pearls and pitfalls for the week, how to stay on path with the plant-based diet and to keep you losing weight down to your 18-year-old weight where you feel good and you're ready to conquer the world. So this has been helpful. The members talk amongst themselves and share tips and share successes, and we help each other out. It's great. If there's a little trepidation about telemedicine, it is the future of medicine, and there are devices that are helping this out. It is true, one of the limitations is I can't get a heart or lung exam through the telemedicine visit. But you could get a device called this Taito Care device, which is really cool because it can record a lung and heart exam, an ear exam, or throat exam, and can blast it over to me and I can see it. And so this device, if you are interested in this device, I have a $75 off coupon code called VPC, Vegan Primary Care. Okay, just a couple of slides, 2 slides today, some things that I've been focused on. I want to mention, gosh, you got to love this Dr. McDougall, John McDougall. He has been, talking about the plant-based diet for years and years, at least since the 80s. And he has come up with this simple book called the McDougall's Color Picture Book of Food Poisoning. And, I don't want to spoil it for you, but it's pretty simple. It's pretty simple. And he has come across with a simple message for years and years. So you got to admire him for that. And so if you type in McDougall's Color Book of Food Poisoning, if you search it, you can see it. And he will recommend green light foods, yellow light foods, and red light foods. Not to spoil anything, because it is a good thing to peruse, but the green light foods are vegetables and fruit, and even starchy vegetables and grains. And the yellow light foods are a little bit higher calorie density. Even some things that are plant-based, or all plant-based things like avocados, dried fruit, even some sort of mildly processed foods like tofu, and smoothies, which are blended up, and you can drink them a lot and have a high calorie meal, even though it's plant-based and considered healthy. You can drink it so fast that you can get too high of a calorie load. So these are yellow light foods. And then red light foods that you just shouldn't consume: animal products such as cheese, meat, eggs, and fish, and vegetable oils such as olive oil, canola oil, safflower oil. All that is inflammatory. It's bad for you. And then one of the last things is obviously pastries and cakes and sweets that are just where it's sugar as the food. These are bad for you. And so I love this. This is a homage to Dr. McDougall and his simplicity. It's so simple, and it really works. Okay, here's something I want to mention. Another giant in the field, Dr. Joel Fuhrman. He is just, these folks are my gurus. I consider them vegan royalty in a way. And I don't want to put words in his mouth, but I made sure that he actually said these words. He's definitely talked about this in the past. Metabolism. What if slow metabolism is the secret to longevity? And a lot of people complain like, oh man, if I go on this, or if I eat low protein or this and that, I'm going to have a slow my metabolism. And the idea is that animals that tend to have a slow metabolism live longer, and the animals that are really fast, that have a fast metabolism, die sooner. So the goal should actually be to have a slow metabolism. We slow by basically eating, decreasing the amount of calories that we're eating. And if we have a very slow metabolism, that we can maintain our weight with a lower calorie diet. So I thought that was a unique perspective. Very cool. Okay, so I'm going to stop my screen sharing and go back here. Okay, so today we've got several people watching, giving me some love. Thank you. If you like this, broadcast, go ahead and hit like. Smash the likes. Smash them. Smash those likes. And if you're on YouTube, smash a like and subscribe. That helps me out a lot. If we get 100 subscribers, then we can change the name to YouTube at Gobbledygook to YouTube at Vegan Primary Care. So that would be cool. So I will ask our participants here to go ahead and send in a question. Any questions specifically about a plant-based diet, but I'm a primary care doctor, anything you may have. If you have something very personal to your health, very specific, make it generic questions, but if it's something very specific to you, you can always reach out to me on Facebook and send me a direct message. Okay, so we have people watching on Twitch, and we have people on Facebook. So this is kind of cool. All right. Unfortunately, okay, Ryan Blint says, do you have Florida Blue insurance yet? This is a big disappointment, Ryan. Unfortunately, we don't have Florida Blue. We have now brick and mortar, and we have applied back to Florida Blue. We were hoping 3 months, but 3 months has turned into 6 months, and now they're sort of saying, well, maybe much longer. So this is quite depressing, but we're moving forward. We do not yet have Florida Blue. I'm so sorry, Ryan. Folks who want to see me cash, just so that you know, I do have lots of patients who see me cash is $150 for a 1-hour visit or $75 for a 30-minute visit. And a lot of times we can manage with a single visit, and then we can deal with things like labs and follow-ups and stuff on the phone, which and through messaging, which are not costly at all. So we've got a question from Rick Nelson. All right. Are the fake meats, what I think the question might be, are the fake meats, the fake meats in the yellow category? Okay. Well, Dr. Fuhrman, I think that he put, I have to double check. You may have to check this one out for yourself, if he put fake meats in the red category or the yellow category. I know he puts tofu in the yellow light category, just because you just want to be cautious. You don't want to eat them with reckless abandon because they're high calorie foods. And so I would put fake meats and cheeses in the orange category. They're in between yellow and red because they are very high calorie and they have saturated fat. And we know that this is bad for you. Now, it doesn't have the same cancer risk in terms of the IGF spike that you'll get from animal protein. IGF, insulin-like growth factor, can grow tumors and things like that. And so fake meats and cheeses should not affect the insulin-like growth factor in your body, but they are still very rich. Now, they're good transition foods if that's what you need. If you have to use these as a gateway to the plant-based diet, but the number one way you should use a whole food plant-based diet. Ideally, you're eating foods that are in their whole form. They look like they were when you pick them, where they're in the garden and that sort of thing. Minimally processed. This is the goal. Thanks for the question, Rick. All right. Karen Hodgen. Karen Hodgen says, if your cholesterol is less than 130, according to Dr. Esselstyn, you are heart attack proof. Why does he say that? Okay. This is great, Karen. Now, Dr. Esselstyn and Dr. Ornish, they proved that you can reverse coronary artery disease. So that is like, there's no diet that has proven to reverse coronary artery disease other than the plant-based diet, the whole food plant-based diet. So everyone should be on that diet until proven otherwise, because it's our number one killer. Heart attack and vascular disease such as stroke is our number one killer in the United States. Killing 1/3 of all Americans. So why does he say that if you get your total cholesterol under 130 and your LDL cholesterol under 70, you're almost or potentially heart attack proof? Well, he's extrapolating that from Framingham studies, which studied thousands of people over time and correlating seeing the LDL numbers, the cholesterol numbers with the heart attacks. And he's saying that numbers that if people's cholesterol is down so low, they tend to not have heart attacks and that sort of thing. So that's what I tell my patients. Our goal for the LDL, I focus on the LDL, not the total as much, to try to get it at or near 70, which kind of has that same effect on the Framingham risk. Okay, thanks for the question, Karen. Now we have Teresa. Is all meat or animal protein in general pro-inflammatory? The answer is yes. Yes, Teresa. Yes. So one of the there's 4 or 5 different things at least. Hyperfiltration through the kidney. Your kidneys have to work harder. The filter has to work harder to get through the animal proteins. The IGF-1 insulin-like growth factor hormone that could potentially make tumors grow. Inflammatory problems with barbecuing and destroying the chemical components of the meat, causing your body to be inflamed due to the hydrocarbons and that sort of thing. Endotoxin from bacteria that is in the meat. Bacteria, after the animal dies, is slaughtered, bacterial release endotoxin, and it's heat stable and it remains in the meat. And so every animal product that you eat contains a little bit of endotoxin. And there's things like low fiber foods and bacteria that consume these low fiber animal products are not helpful for you in their microbiome. They tend to be pro-inflammatory. They don't produce those short chain fatty acids that help the lining of our intestines, that reduce inflammation. There's many reasons. There's also something called TMAO, especially something that happens when you eat eggs and foods high in choline. The bacteria in the intestines will produce this TMAO compound from the high choline containing foods like animal products and eggs, and that's inflammatory in the system. So for many reasons, along with saturated fat and cholesterol, I could go on, but in the sake of answering all the questions, let's go. Elizabeth Markowitz, hello. You are the best. That is very sweet of you. I appreciate it. I didn't prompt her to say that, folks. Okay, Skylar King. Hi, Skylar. Hi, I know that bread isn't the best for you, but would you say that Dave's Killer seeded bread is a good choice if you were to eat bread, or is it all the same? I like this question, and I will endorse Dave's Killer bread. It's a bread that I use. There are some breads that would be better than Dave's Killer bread, but Dave sort of has some whole grain and high fiber, but it's still sort of lower on the glycemic index than things like beans and even pastas. Pastas are pressed and a little bit are harder to digest a little bit than breads. Breads are easier to digest, and the little bubbles in the bread and how processed it is makes it easy for your body to digest, and you get a hit of sugar. It raises your insulin. So on the spectrum of carbs, we need carbs. You got to eat them. You got to eat them. It's our main fuel. The best carbs are beans, and then whole grains in their intact form, like wheat berries and all these ancient grains and all this stuff. That's the best. And then corn is kind of next on the spectrum. And then we're getting into brown rice that has its husk on it. And then we're getting down to pasta, and then wheat flours and bread. And then, so bread and potatoes, these are lower on the, or they are higher on the glycemic index and a little less health promoting than these other carbs. However, like the McDougall thing I was talking about before, McDougall has potatoes and all these things on the on the green light foods that you have to center your meals around. So if you feel like you're feeling hungry even after you've ate before, try to stick on this farther end, on the lower end of the glycemic index carbs like beans and whole grains, and you'll feel more sustained. So back to the question about Dave's Killer. Yes, Dave's Killer, I recommend it. That's the one I eat when I'm eating bread for peanut butter jelly and sandwiches and stuff, avocado toast. But there are breads that are better and lower glycemic index, such as Ezekiel bread. And there's this very thin sliced bread that's in the ethnic section. I forget what you call it. Maybe someone can type it in, like mescal bread or Merkel bread or Mendel's bread or something like that. But yeah, these are really high in the whole grains and lower on the glycemic index. Okay. Janice Hugel, UTI advice, vegetarian transitioning to vegan. Is it menopause? Some people claim to have a benefit with, if they happen to have frequent UTIs. Frequent UTIs can be it's a real problematic thing, and it's really frustrating. It is more common in women than men, just for the length of the urethra and the anatomic differences. And it's frustrating. They recommend frequent urination, especially after intercourse, urination. If there is after menopause, sometimes the UTIs can go up due to as estrogen goes down. There can be anatomic changes that makes it more likely for you to have UTIs, just kind of spontaneous UTIs. But if you're getting UTIs very frequently, you definitely want to have check in with your doctor. Sometimes they'll recommend prophylactic antibiotics. I tend to not be someone who likes to use a lot of antibiotics, but if you're dealing with UTIs frequently, then you may have to require a prophylactic antibiotic to take in high UTI, in situations where you may expect that you get a UTI, you could take one prophylactic antibiotic to prevent it. But if this is happening all the time, you want to be evaluated. You want to be figured out, why is this happening all the time, and if there's any way to prevent it. And that's definitely someone that you should go and visit the doctor for, because they could also talk about the prophylaxis as well. That was a very good question, Janice. I have heard people claim that their frequencies of UTIs dramatically improved after switching to a vegan diet, but not 100%, not going away 100%. Now, I will say that there are symptoms of bladder irritation that you can get from your foods. Now, we all know what it feels like when you pull up to the house and you've had to pee while you're driving in the car and it hurt, you had to pee. But then when you got to the house, all of a sudden, your bladder is really having a spasm and you really have to run to the bathroom. So it's almost like the bladder knows. But what I'm saying is people know what bladder spasms feel like, and they know it hurts. And so sometimes, believe it or not, foods can cause irritation to the bladder. Just like you can have an irritated stomach from certain foods. Stomach is a bag-like organ. You can have irritation in the bladder. We've all experienced when you eat asparagus, for instance, you can have a change in this in the odor of the urine. So you know that chemical compounds from the foods that you're eating are making it into your urine. And some things are more irritating. The number one is coffees and teas, and different things like energy drinks. You'll notice sometimes irritation, bladder spasms from these foods. Citrus is a big one. Some people claim that certain foods really irritate them. So that's called a bladder irritation. And you can look it up online and do an elimination diet. Sometimes people will get UTIs, they'll get the symptoms, and they'll test, and it'll be negative. And this is because of bladder irritation from specific foods. Now, sometimes the last point on this is if you do an elimination diet and you find foods that cause pain, those same foods might have been foods that you tolerated in the past, but it's just that your stomach your bladder was irritated and couldn't tolerate them right now. So it's not if you find that orange juice and citrus and stuff irritates your bladder, it may not be that way all the time, just when it's inflamed, so to speak. So Janice, that is a good question. Thank you so much. Okay, scrolling down here. Okay. Oh, Rick Nelson. Okay, I know Diet Coke isn't the best for you, but I'm an addict. I've scaled back 1 to 2 per day. Does this spike insulin levels as much as sugar? Rick, yes. The concern is that the body perceives the sugar, the sweetened beverage, to be sugar, and so it can produce an insulin spike. The overall concern and health concern is that this is food that's made in a factory, and it's artificial. Artificial sweeteners are known cause for things like migraines, and some people complain of very significant problems related to artificial sweeteners. So you're doing your best. You may want to switch over to natural products like coffee or tea. Sometimes you can do the tea bag method where, you start with 2 tea bags and then you drop it down to 1 tea bag. I mean, you're going to have headaches when you get out of caffeine as you wean down. I myself, unfortunately, I am still a caffeine drinker. I do think it's probably best to be off of caffeine, but there's kind of mixed results in the literature. Sometimes they'll say, well, people who drink caffeine have more normal blood sugar for longer time, less diabetes and stuff like that. I don't think that this caffeine could be this miracle drug. And but I have headaches if I stop drinking caffeine as well. So the biggest problem with caffeine is insomnia. And it will do you wrong. You can stay up all night and then it won't clear your mind, and then you'll have mental fog all the next day and you're drinking more coffee. So the problem with caffeine, it's a minor sin. It is a minor sin, but the problem is insomnia, which can relate to other problems and stress in your life. So you've never had as good a night's sleep as when you try to come off of caffeine. You'll sleep like a rock. So yeah, Rick, I recommend continuing your efforts to get off the artificial caffeinated products and get on more ones that contain health promoting products like green tea or at least tea or coffee. All right, Rick, good point. Way to bring that out. Caffeine, it's a heck of a drug. Okay. Leah Noblet. Are there any specific vegan foods that you would recommend to increase female fertility? Okay, good question, Leah. Well, just in general, the plant-based diet has been shown to increase the number of preliminary, I believe the story is that it increased the preliminary follicles and increased the rates of ovulation in women who, are having fertility issues. Now, if people are overweight, you have the higher estrogen component from the fat producing hormone and even being changed to testosterone, to the androgenizing concerns from overweight. So the plant-based diet, people tend to get down to their 18-year-old weight if you're eating a whole food plant-based diet. And so there are several reasons. One is to have a decreased, more normal body fat percent. And 2, that it actually has fertility effects, has been shown to improve the follicles that and improve ovulation rates. But are there any specific ones? I do recommend flax. I do recommend ground flax every day for the lignans, which can be helpful for things like menopausal symptoms and regulating estrogen a little bit. But I'm not really specific if lignans themselves from flax is actually increased fertility. I'm not sure about that. But that is a very good question, Leah. Definitely plant-based diet is helpful. Okay. Rebecca Broadway. Becky. Hi, Dr. Harrington. Can you explain the double digestion of beans? You mentioned it, and I'm intrigued about how it works and how do you get the benefits from that? Okay. Thanks, Becky. Becky's a longtime friend. It's nice to see you here on the broadcast. So, beans are amazing. The magical fruit. Beans are good for your heart. The more you eat, the longer you live. I love that. So beans, as the body breaks down the beans, you get an initial carb load from the beans. And so you get initial energy from them, but they contain the highest amounts of the carbs, the highest amounts of fiber and resistant starch. And this slows down their digestion. And so as it travels along into the, and gets broken down by different bacteria in the intestines, then you start to release fermented, some of the resistant starch gets fermented, and you release more carbs and more energy from the beans. So yes, beans are the best. Everyone should include beans in their diet every day. If you're not used to eating a lot of beans, it can cause a significant amount of gas and some bloating and some little bit of like, you can feel your intestines kind of rumbling and stuff. So you can kind of work yourself up to it. Don't be scared. Don't be scared. Beans are amazing and have so many beneficial properties. They're loaded with vitamins and minerals and fiber for your gut. And so yes, thanks, Becky. Beans are where it's at. Okay. Teresa Gleason says, what are the best pre and post workout foods? Okay. It's kind of interesting. I was highlighted on the Plant-Based Athlete podcast, and we got their book, the Plant-Based Athlete book that they just put out. And they go over pre and post workout foods. I've been in the military, and one of the biggest things with pre and post workout is in the military is concerned is that if there's an assault, if you have a movement with the troops, that you always have to be prepared for a counterattack. So after you spend a lot of energy and you do a workout, the muscles are primed to receive the nutrients right after you work out. And so you have the quickest sort of recovery if you eat something is pretty soon after your workout. And so the carb to protein ratio is like 5-to-1. Basically, you just eat. So a lot of people are worried about getting certain pre-workout supplements and this and that. I don't eat before I work out because it kind of can make me feel like a full stomach and it's jostling around. But afterwards, it's good to have food available so that you can refuel more quickly. But honestly, the pre and post workout, all that stuff is kind of overblown in my perspective, that you just want to basically exercise, whatever you can do to get yourself to exercise. Now, people can bunk, people can be on a long run, and they can, remove all their glycogen out of the stores of energy in their muscles, and you can get some quick energy from these like goo brand workout foods. But unless you're doing some very long activity, you wouldn't necessarily need to have like a during the workout food. So good question. Okay, we're getting good questions here. All right. Okay, we've got a question from Beatrice. I'm going to suggest that, Beatrice, that you go ahead and send me a direct message if we want to talk to me about a specific product. We can do that. All right. Okay, we've got here a question from Shirley. Just trying to find out about lymphedema and what foods to eat to starve it. Okay, so lymphedema, if you ever have surgery and you have surgery on your lymph nodes, the lymph system, there's a 3-system highway. There's arteries, it's taking your blood out to your tissues, veins, taking the blood back to the heart to get repumped, and then the fluid in the arteries, the plasma, the stuff when you spin down blood, you get the blood cells at the bottom. The plasma is this yellow type fluid up at the top. Plasma seeps in a little bit into your tissues and provides nutrients and things. But on that third highway, the lymph system, there's another tube that runs back to the center of your body. And this system, when they do lymph nodes and they remove it, or there's a mechanical blockage of the lymph system, you can have swelling. And so lymphedema is very hard to treat once you have the mechanical issue, once your anatomy is altered. So it's a mechanical problem, and you treat it with mechanical ways. Like you could do wraps, you can do propping up, and this sort of thing. And the assumption is that if you have persistent lymphedema, it's a mechanical issue, and there may not be necessarily a cure for it. Now, people who have heart failure and who have generalized edema, swelling all over, that's because their pump is not working well. The kidneys don't see very much blood pressure because the pump is not working well. So they say, hey, I'm not getting enough blood. The kidneys do. So you know what? We should retain fluid so that we'll get more pressure in the tank. So the kidneys then will retain fluid and you start to swell. So the way you help to try to prevent that is by eating a very low salt diet. So processed foods like, Campbell soup type stuff and, ramen noodles and those packets, salt packets that make things taste really good. These kind of things are just loaded with sodium. And so you want to reduce sodium to help with generalized edema. Lymphedema from a mechanical obstruction is treated mechanically by raising it up and by wrapping and stuff like that. I hope that helps, Shirley. Okay. Are we concerned about BPA in canned beans? BPA is something that you want to avoid. If possible, you look for BPA-free cans. I think this is something that, good question, Elizabeth. I think this is something that is starting to be less and less in the canned food industry, and that's something that you should look out for. That is a very good point, Elizabeth. All right, last question today. Skylar King, is avocado and coconut oil also as bad as olive oil and vegetable oil? Well, coconut oil is probably the worst. It has the highest numbers of saturated fat. Saturated fat is worse for you than the unsaturated fats, the polyunsaturated or monounsaturated fats. So, however, avocado is a whole food. So of these things that you mentioned, avocado is the best. It contains phytonutrients. It contains fiber to some extent. And so this avocado is a yellow light food, treated as a rich food. Now, oil is bad. It's inflammatory. It's had its nutrients stripped out. The way you have to think about oil is like how we think about sugar in Coca-Cola. It's an empty calorie. It's energy, but it's just bad for you, and it has lots of negative properties. So oil is the same way. Oil, you need to think about it as almost like the sugar in soda, as an empty calorie and harmful. So I hope that helps. Olive oil is not that much better than other oils. It is technically a little better, has a little bit more vitamins in it, but overall it's almost just as bad. I think that we've come to a stopping point. I hope you've enjoyed this broadcast. If you have questions, hit me up on DM. If you like the broadcast, smash the likes. If you're on YouTube, hit subscribe. And we will go ahead and see you next week at 12 Eastern Standard, same place, same time. Okay, take care. Every Wednesday. Bye-bye.